Hello again, everyone. Welcome to Fayette Regional Health Talk. I'm Doug Fischesser. Thank you for joining us. Tammy Dowd is out this month on special assignment. As always, Health Talk is made possible by TV3 and Fayette Regional Health System, so viewers in the Whitewater Valley can be better informed of health and wellness topics and opportunities in your area. And Fayette Regional Health Talk is also your source for up-to-date health news and events that are important to Connersville, Fayette County, and the entire Whitewater Valley. Leading this edition of Health Talk News is a reminder that Fayette Regional Health System has extended hours for your immediate care needs at their Fayette Regional Primary Care Center. Fayette Regional Primary Care Center has a full staff of care providers with Dr. Ryan Minnick and Dr. Jessica Douillard, along with experienced nurse practitioners. They can take care of all your immediate care needs 7 days a week. Walk-ins are welcome Monday through Friday, and even on weekends for adults, seniors, and kids too. Fayette Regional and ClaimAid would like to help the community better understand the recently approved Indiana Medicaid Expansion Program, Healthy Indiana Plan HIP 2.0. HIP 2.0 is an affordable health insurance program for the state of Indiana for uninsured adult Hoosiers. The Healthy Indiana Plan pays for medical expenses and provides incentives for members to be more health conscious. HIP 2.0 provides coverage for qualified low-income Hoosiers ages 19 to 64 who are interested in participating in a low-cost, consumer-driven healthcare program. It's a great plan for people to work with their doctor for more effective and preventative care. Choosing a healthcare provider, determining monthly premiums, and understanding health insurance plans may be difficult for individuals and families who have never had health insurance. Fayette Regional and ClaimAid can help give you an overview of HIP 2.0, outline who is eligible to apply, and explain how to utilize the program. If eligible, ClaimAid has certified navigators available to guide you through the entire enrollment process. There are free education seminars scheduled throughout the area. If you would like to attend, have any questions, or would like to enroll in HIP 2.0, please contact Tricia Blevins at Fayette Regional by calling 765-827-8998. As part of Fayette Regional's continuing efforts in community outreach, we are providing monthly screenings and activities, as well as participating or hosting several events in and around Fayette County. The first Wednesday of the month, Fayette Regional will be at Fountain Place Apartments in Connersville to provide education and activities beginning at 2 p.m. To end the first week of each month, Fayette Regional Care Pavilion and Jerry Sykes Services host a Caregivers Relaxation Luncheon on the first Friday from 11 a.m. to 1 p.m. Caring for persons with chronic illness is a rewarding endeavor, but often places extreme demands on the caregiver, who can sometimes become overwhelmed trying to balance work, family, and caregiving demands. This can result in the neglect of their well-being. We are pleased to offer this Caregivers Relaxation Luncheon as a time of respite for caregivers to refresh mind, body, and spirit and learn ways of taking care of themselves. Call 765-827-8022 for more information or to make your reservation. The second Tuesday of each month is a busy one for Fayette Regional. Southview Courts in Liberty, Indiana hosts Fayette Regional blood pressure and blood sugar screenings are provided along with education and activities. Fayette Regional is also at the Franklin County Senior Center at 9 a.m. the second Tuesday of each month, again providing education, activities, and health screenings. Continuing on the second Tuesday of each month, Fayette Regional offers a free lunch and learn to area seniors at the Fayette County Senior Center. This monthly event is always well attended and free health screenings are offered. Our presentation begins at 11:30 a.m. and lunch will be served at noon. If you wish to attend, please make your reservation by calling the Fayette County Senior Center. Fayette Regional staff and the community alike raise their sleeves throughout the year to give the gift of life. Last year, over 60 units of blood were donated, helping supply over 60 hospitals in Indiana. Please join us by supporting these blood drives. Go to FayetteRegional.org for a full listing of blood drive dates. Please tune in for TV3's listing of local events to find other special events that Fayette Regional is hosting in your area each month. We look forward to seeing you. When we return, our guests will be in the studio to introduce us to a great new service offered at Fayette Regional. We'll be right back.
Fayette Regional is proud to welcome Dr. Amy Wynn to our Healthy Women OBGYN staff of physicians. Joining Dr. John Landry, she will be providing outstanding OBGYN services to the women of Fayette County and the Whitewater Valley. Visit their offices at 3542 Western Avenue or give them a call at 765-825-0538 to set up an appointment. Great care is right here at Fayette Regional.
Welcome back. Joining us now is Dr. Danielle Turnak and Rachel Rose of the Fayette Regional Pain Management Center. Thanks to both of you for joining us here today.
Thank you for having us.
We're glad we could be here.
Good. Well, let's start by finding out a little bit about each of you and your roles at the Fayette Regional Pain Management. Doctor?
I'm Dr. Danielle Turnak. I'm an anesthesiologist that is boarded also in chronic pain management. I went to Purdue for my undergraduate degree. I then proceeded into IU, School of Medicine. I received my medical school degree from there. Went to Connecticut, did my internship in internal medicine, came back to Indiana, went to IU for my residency and anesthesia, and then did a fellowship in pain management there. I've been doing chronic pain management for about 16 years in several small community hospitals around Indianapolis. And we look forward to starting the Balanced Care program here at Fayette.
Great to have you. Rachel, a little bit about you.
My name's Rachel Rose. I am a registered nurse. I am a recent hire to Fayette, so this is my first role in the Fayette hospital system. I will be the RN supervisor for the Pain Management Center. Prior to this, I have a background in critical care nursing, so that's where I come from, and we are excited to get our doors open and start seeing patients.
Doctor, could you explain to us a little bit about what balanced pain management is?
Balanced care medicine is when we use several modalities to improve on a patient who has chronic pain. We use not only physical therapy, bracing, some radiographic studies to determine what's going on, as well as using adjunctive medications, interventional procedures as injections in the OR, and also using some pain medications. Our goal is to try to get people to have better mobility, decrease pain, and better function, and feel better.
I see, good. What are some of the common conditions that you treat?
We treat a lot of different things, kind of from head to toe. We are able to treat certain types of headaches called greater occipital nerve blocks, or is what we use to treat those type of blocks, those type of headaches. We treat different disease processes of both the neck and the back, whether it's a radiculopathy caused by a pinched nerve or arthritis that's causing pain in the neck or the mid-thoracic area or in the low back. We also do things as far as SI joints, which is sacroiliac joints that cause pain, greater trochanter bursitis. We also do things along the lines with muscle spasms and sympathetic mediated pain, which is given a name of complex regional pain syndrome.
I see. You mentioned the use of procedures as part of the interventional pain management. What are some of the procedures that you do use?
A lot of the modalities that we use are done in the OR. We do some injections in the clinic setting, but most of them are done in the OR in a clean area, which under x-ray guidance, we use different medications, usually a steroid, always a local anesthetic, to try and block pain, reset pain, decrease inflammation, and also diagnose where the pain is coming from. Some of those injections can be epidural steroid injection, nerve root blocks, facet joint injections. We do intercostal blocks. I do sacroiliac joint injections, trigger point injections, greater trochanter injections. Some of the modalities will lead to other injections that are used with radiofrequency. And radiofrequency is a type of injection that we try to turn off pain generators of the pain to, again, to increase mobility, increase function, and decrease pain.
I see. What are the typical recovery times on some of these procedures?
Most of the procedures, the patient will have to take the day off work, but they can go back and do their normal activities the day after. There's a few modalities that usually might take a little bit longer for the injections to work, but most injections, the patients are able to go back to their normal activities of daily living the next day.
I see. So the patient can be up and around in the same day as the procedure, in other words, in most cases?
In most cases, yes.
I see. What made you want to specialize in pain management? I mean, what really got you fired up to get into all of this?
I was interested in both internal medicine and anesthesia. And when I went into my internship, I did an internal medicine internship to see whether or not that was the study that I wanted to do. Then I worked into anesthesia. And when I was into anesthesia, I enjoyed it greatly, but I missed that patient contact. And then when we had rotations through the pain clinic, I realized it was kind of best of both worlds. I was doing some of my internal medicine kind of patient interaction along with the procedures that we learn as far as anesthesia. There are so many people that suffer from chronic pain, and it's a very rewarding field to do, that we can try to get people to be more active, get out of their problems that they have with chronic pain. It can limit their activities with their loved ones, their job, their sleep, and their just enjoyment of life. So we really enjoy doing that. Being board certified in pain management, it gives me a unique experience to try and help these people.
Well, I think with exercise and things that people are health conscious these days, I think that obviously a lot of this will come in handy with the typical aches and pains that everyone goes through each day. So what's the biggest misconception about pain management?
I think the biggest misconception is that people think that if you go to a pain management center, you're just going to get medicines thrown at you. Mm-hmm. You're going to live the rest of your life in a stupor. And that is not our goal. Our goal is to get people off any kind of narcotics, to get them moving better, feeling better, and trying to get back into their activities of life. We want to make people better, but not sedate them and not being able to enjoy their loved ones.
I see. Do patients need a referral to make an appointment with you in the clinic?
Most typically, we do have a referral come from a primary care physician. However, we understand that not all patients have those primary care doctors that they see. So in those cases, they are welcome to call the center, and we will do our best to hook them up with a doctor who is currently accepting new patients so that we can make sure that all aspects of their care are being treated.
I see. Will this program help link patients to PCPs and taking the new patients?
I think that's our goal here, is that we want to link those patients in the community that don't have a primary care physician with those physicians who are accepting new patients and are available to take care of any of their other concerns besides pain.
I see. Where is the clinic located?
The clinic is actually located in the hospital, in the part known to most people as the Cancer Care Center. They have opened their doors to us and have provided us space within that facility, and we are lucky to call that our home.
Good. Give us a little info on patients calling and making an appointment and things like that, the numbers and all of those things.
Okay. The best number to reach us at is the 765-827-7850. That is our primary line, and that's how you can reach myself and the other staff members that are in the center with us. And from that process there, we can handle referrals either from physicians, offices, or even somebody who is just curious about what the process is to get in to see Dr. Turnak and to have their pain treated. We will have our first day here towards the end of October, and we're going to start seeing patients as soon as we can, and we'll be open the day of clinic from 8 to 5, so hopefully we'll get a lot of people in through the door.
Great. Well, is there anything else you'd like to add?
We will be serving populations of age groups starting at 19 and going all the way through our senior citizens group. I'm not really versed well in pediatric pain, but we will be handling all adult pain at the clinic.
The only other thing that I would like to add personally is I wanted to make sure everybody was aware that we will be accepting all insurances that the hospital currently accepts. So this includes the HIP 2.0 and the Medicare and Medicaid.
Great. Well, we're looking forward to this great program starting not only at the hospital but for the community. So we appreciate you being our guest today. Thank you.
Thank you.
Thanks for having us.
Please stay tuned. We'll be right back.
Fayette Regional, Mental Health Minute.
All of us experience times in our lives when the scales of life become out of balance. Usually we can rebalance our scale by addressing the issue at hand. There are times, however, when we need help. When our mind becomes out of balance, we may be confused, unable to make decisions, or make decisions we shouldn't. We may misinterpret the world around us or create our own reality. It is estimated that 1 in 4 people have treatable mental or emotional difficulties, but up to 75% of Americans don't seek the help they need. Fear of treatment, shame, and embarrassment are keeping a large number of people from seeking help for emotional and mental problems. When the scale is out of balance for too long, or you can't do it alone, seek professional help. For further information on achieving a life in balance, contact Fayette Regional Care Pavilion at 765-827-8022. There's help, there's hope.
It's time to shift gears and talk to one of our good friends from Area 9 about an upcoming event that they are sponsoring. We would like to welcome in Rhonda Scott. Thanks for stopping by, Rhonda.
Thank you.
Can you tell us a little bit about yourself and what you do at Area 9 and what services does Area 9 agency provide?
Well, I am the caregiver coordinator at Area 9 agency. Area 9 is an in-home and community services agency. We are known as the Area Agency on Aging, and we are an ADRC location, and that's the Aging and Disability Resource Center. Some of the services that we can provide is we help provide in-home services, and we also help provide Meals on Wheels and caregiving services to people who are in need of caregiving.
I see. Tell us about the upcoming caregiver retreat event.
Well, this will be our 4th annual caregiver retreat, and it is held at the Leland Legacy, and that is, the address there is 900 South A Street in Richmond, Indiana. And it's this day that we try to give back to our caregivers. Some of the things that we're going to be having going on that day will be, we have Elaine Voce, she's a life coach, and she's going to be talking about mindfulness and how to do caregiving so that you enjoy your life now, and you will also be able to have a life to return to when your days of caregiving has ended.
I see. Who is a caregiver? Can you give us a little bit of background on that?
A caregiver, ones that we normally try to help with are the informal caregivers, and those are people who are not paid to caregive. They're known as family caregivers. This can be a friend, a neighbor, a family member, anyone who's helping out with someone's care. They're checking in on them, they're helping with medications, they're taking their mail, they're taking them to doctor's appointments. This can also be people who are actually providing hands-on care to them also.
I see. How long has the caregiver retreat been held?
Again, this will be our 4th annual, so we've been doing this for 4 years.
Rhonda, why is the caregiver retreat logo a parachute with a heart?
Well, a parachute is a device that helps slow the motion of an object through the atmosphere. The term originally means that it protects against a fall. So when a caregiver is in a crisis, it can feel like they're free falling from the sky. The stress and adrenaline makes it hard to breathe. So the caregiver program wants to be there to help be your canopy, to help provide you with a safe descent.
I see. When and where is the event?
The event will be at the Leland Legacy. The address there is 900 South A Street in Richmond, Indiana. It is on Thursday, November the 5th. It's always the first Thursday of the month, from 8:30 a.m. to 3:30 p.m.
I see. Okay. What's on the day's agenda?
Well, we begin the day with the registration, and we'll have coffee and donuts available to caregivers. And then we will be talking with Elaine Voce. She is a PhD and life coach from the Indianapolis area. And she's going to talk to people about mindful caregiving, how it gives you the power to build a life worth living now and a life that you want to return to when your caregiving days are over. And then we'll be doing pampering with the caregivers, and we'll be doing chair massages, we'll be doing nails, hand paraffin wax treatments, eyebrow waxing. We'll have people there, booths open for shopping, because a lot of times it's really difficult for caregivers to get out to be able to do shopping. So we'll have those there. We'll have sparkling juice and strawberries available. New this year, we're going to have a reminiscing room, and it's just a place where people can go to sit down and relax. It's going to be a 50s theme. Ollery's homemade ice cream will be there, and they will be serving root beer floats.
Great. Sounds like there'll be a lot of things for a lot of people.
Yes. Lunch will be provided by MCL Cafeteria. And then we'll have Dennis Frick from the Senior Law Project. We'll be talking about legal issues. And then after that, we'll be doing an activity. We'll be making calming stones.
I see. Great. Sounds like a great full day.
Yes.
Are reservations required?
Yes, we do recommend that you RSVP by October 28th. Seating is limited. The number is 765-966-1795.
Great. In closing, is there anything else that you would like our viewers to know about Area 9 and the Caregiver Retreat?
We just hope that everyone that does attend, it's such a joy when we're there and you see caregivers come in and they're really stressed and they leave the day and you can tell that they just feel more relaxed and they have smiles on their face. It's really important that you do try to take care of yourself as a caregiver, because if you don't have anything from yourself to give, then you can't help the person you're caring for.
That's true. That's true. It really is a great thing. Well, Rhonda, thanks for joining us today. Be sure to tell all your friends now that you're on TV that the popularity is gonna soar through the roof. So we're very glad to have you with us today. So thank you.
And thank you.
We'll be right back.
Fayette Regional.
Jerry Psych Services is a medically managed, short-term inpatient unit for seniors 65 years of age and older, available 24 hours a day, 7 days a week. Please join me for a closer look at the new Fayette Regional Jerry Psych Services.
Hi, I'm Randy White, President and CEO of Fayette Regional Health System, and I would like to welcome you to the geriatric services of the Fayette Regional Care Pavilion. The goal of Fayette Regional Health System is to be East Central Indiana's healthcare leader through state-of-the-art facilities, superior care, and service excellence. I am honored to present to you Fayette Regional Geri Psych Services at the Fayette Regional Care Pavilion.
Recent studies have shown that nearly 1 out of every 5 Americans, some 72 million people, will be 65 years of age or older by the year 2030. As these seniors begin to experience the disorders associated with aging, access to quality mental health services is critical. Fayette Regional recognizes this great need and is honored to provide this service facility.
When one person in the family suffers with a mental or emotional illness, everyone else in the household is affected as well. Fayette Regional Geri Psych Services offers a warm and supportive atmosphere to help minimize this impact. Upon admission, we will perform a thorough evaluation to determine what is causing the behavioral changes. We provide services with primary psychiatric diagnoses such as mood disorders, cognitive disorders, delusional disorders, psychotic disorders, and/or anxiety disorders. Here at Fayette Regional Geri Psych Services, there is hope.
The goal at Fayette Regional Geri Psych Services is to return our patients to the best possible level of health. Our treatment team includes psychiatrists, physicians, registered nurses, and clinical social workers. Also includes occupational and physical therapists as well as activity therapists. We will work our hardest with the patients and families and medical care providers to develop an individualized treatment plan. This includes one-to-one psychiatric meetings, peer group therapy, and therapeutic activities and leisure activities. Additionally, we will offer our family education, aftercare, support and instructions, and caregiver support to assist in coping with these very sensitive issues and diagnosis of our loved ones.
For more information information or to schedule a free consultation, call Fayette Regional Geri Psych Services. Our staff is available 24 hours a day, 7 days a week. All information is completely confidential. Fayette Regional Geri Psych Services. There is help.
There is help.
There is help.
There is help.
There is hope.
There is hope.
There is hope.
There is hope.
That's all the time we have today. We look forward to everyone joining us again next time on Fayette Regional's Health Talk. I'm Doug Fischesser. Stay healthy, Connorsville.